Well, welcome again to our Q&A with our Public Health Director, Nancy McGraw, who I'm very grateful that you took some time to talk today, because I know how crazy busy it's got to be in the public health team's office. For anyone who doesn't know me, this is Dan Hoos, the Communications Director for Sullivan County. And we just want to connect with folks who may be a little bit concerned or confused or just interested, curious, and more information about how we're dealing with COVID-19 as the cases seem to continue to be in the 3-digit range for us, and we've been issuing quite a few public health advisories. So again, Nancy, thanks for joining us. And if you could, I'd first off like to talk to a bit about how the method that people most often find out what's going on in their communities with the COVID dashboard that we have on our website. And specifically, if you can speak to how we receive and update that data, and why sometimes it's updated at 1 or 2 o'clock in the afternoon and other times later in the day, and how that happens these 5 days a week.
Sure. Well, thanks for having me and for giving me the opportunity to provide another update. The dashboard has been a work in progress, and we're very fortunate to have this as a tool to communicate with the public. And with any new application, you know, we work out the kinks, and sometimes things happen, and we need to make sure that everything's working properly. But what I'm going to do is talk about how the cases get updated. So you may have seen that over the last couple of weeks, our cases have gone up, and then they go down, and then they go up. And I'll explain that a little bit and why that might be confusing for people, because we are continuing to see a steady increase in the number of new positive cases, just like every other county in the state and in the nation, actually, for the most part. It can get complicated because we get lab results several times a day throughout the day, what they call data dumps. And a lot of the information has to be validated and sorted through. We have to verify that people are Sullivan County residents. If they're not, we transfer them to their county of residence. Some of them may be actually duplicates. That does happen. And so all of that needs to be sorted out. Also, the number of active cases will go down after people who are in isolation for 10 days have completed that 10-day isolation period. They're no longer considered an active case. So we could be at 115 today and get 10 new cases. It'll be up to 125. But then 6 people may have completed their 10th day of isolation at the end of today. And so those 6 people will fall off, and you'll see that number of active cases go down. In terms of timing, when the dashboard gets updated, it's really a reflection of how busy our staff are. We have all of our staff working on case investigations. We have assistance with contact tracing with the State Health Department, contact tracers. And we have also are bringing on an additional person to help us as a backup for data entry for the dashboard to keep that updated in case we get so busy that we don't have time to update it every single day. If there's a lag and it doesn't happen exactly at 1 o'clock, please understand that it could be a technical issue, but we do try to keep it up to date as much as we can every day. We do like to give our staff a little bit of a break over the weekends. They've been going hard at this since March, and as you can imagine, it's very time consuming, and our priority has to be doing the case investigations, as well as making sure that the data that's available to the public is timely.
Thank you. And the other way that we reach out to the public is through the public health advisories. And I know I've had questions, you probably have too. Well, I heard there were cases in this location or that location, but you didn't issue a public health advisory for that, but then you issued a public health advisory for this location. How is the determination made to issue a public health advisory?
The primary reason we would issue a health advisory is if through the process of interviewing an individual who tests positive, the staff will get information about who they were in close contact with. If they were in a public setting and location and they cannot identify who they were around, so that we can notify those people that they may be at risk, that's when we do a public advisory. It really has to do with a lot of factors that include close proximity, how long a person was within 6 feet or closer to someone. Were they in the same room? Were both people or all people wearing masks, or weren't they? Or do we simply not know? We need to err on the side of caution for public advisories, so that if anybody was in a particular setting on certain dates and times, that other people could have been exposed. And it just really is a signal for them to be aware and monitor themselves for symptoms, just in case they were at that location. We won't necessarily issue a public advisory on every single situation. It really depends on the circumstances of the exposures and the risk.
If you're not issuing an advisory, it's because you're confident you're able to handle the issue, because it was either like controlled access area or everyone was wearing masks. You've gotten in touch with everyone already in terms of contact tracing. Is that a...
Right. And this is also why, this is how the public can help us in terms of the business community, by routine screening. If you're able to, if you're in an office setting, have people sign in and out. Keep that information confidential, but it certainly would help us with contact tracing. Should there be an exposure, then we could reach out to people if we have a name and a phone number and say, if you were at this location on Thursday between 2 and 5, you may have been exposed.
Yeah.
Rather than if we don't know and there were 10, 20, 30 people who may have been in and out, then we have to do a public advisory.
All right, and then the final question, so I can allow you to get back to your other duties, is the talk of vaccines. We, at least 2 vaccines, I think, are getting close to being approved for distribution. And I know the federal government really is going to handle that in concert with the state government, but have you been working on any kind of plans to receive and distribute these vaccines, or just ready when the state tells you go? How is that working?
Well, when the state says go, we go.
Right.
But yes, we have definitely been doing a lot of planning for several months, anticipating, not knowing when and how much and how soon vaccine would become available. We're certainly getting closer to that. We have, as a local health department, submitted a COVID-19 vaccine distribution plan to the state health department as a requirement, and have identified priority groups that we feel within the county would need to receive it first. And that's not different from flu vaccine during a really bad flu year. We kind of do the same thing in terms of vaccine distribution. If there is a limited amount initially that's coming out, then when you have a crisis, what you do is you identify those who are highest risk and get it to them first. So that would be our healthcare workers. The state health department, in collaboration with the Centers for Disease Control and ACIP, the Academy of, I forgot what that stands for, but they voted, I believe, yesterday on priority groups. And so that is a discussion that will take place with the CDC and the state health department. And then we will follow those priority groups for distribution. So our hospital workers obviously are highest risk, working with sick patients who are actively infected with COVID-19. So they're first in line. And we have a timeline for, we don't know all the details yet. And I'm sure that in the next couple of weeks, we will be finding out more we actually have several calls lined up this week.
Any idea when we might receive vaccines to distribute?
Nothing solidly, but we're being told it's possible in December, maybe December, January. The vast majority of vaccines will not become available to the general public probably until spring and possibly even summer. And that's because of the sheer volume of vaccine that has to be distributed logistically, how much is available and how soon, and throughout the state, where the highest risk areas are, who's going to get it first.
So the plan that we provided to the state, will they generally follow it? I mean, obviously the state can do what they want to do, but is that guidance that they will use and work with us?
Definitely. Definitely, yes. We were asked to submit a plan, and it's in collaboration with the state health department's COVID vaccination distribution plan as well. They actually provided us with guidelines. So priority groups, and also healthcare providers were asked to sign up and become providers to vaccinate their patients. And it'll be, usually distribution goes out to hospitals, local health departments, and healthcare providers first, possibly pharmacies, but that really depends on the storage issues. And then, of course, there's going to have to be follow-up appointments because you have to get 2 shots. So logistically, that is a challenge.
Right. Well, we'll be talking more, I'm sure, down the road about this, but thanks for the time you've given here. I know a lot of people will be watching this and appreciate everything that you and your team are doing. Thank you.
Thank you for your support.